can I help you?
I got a question. My wrist is really bothering me.
Okay.
I think I fell the other night and it's really been acting up, and I think the medicine I'm on isn't working too well.
Okay. Well, why don't we go into the back room and we can have a more private conversation about that. You have a few minutes?
That would be terrific. I do.
Great. Follow me. Hi, my name's Alex. I'm the pharmacist.
Hi, I'm going to give you this hand. I'm John. Yeah, my wrist hurts, so I don't want to give you this arm.
Yeah. Okay, so before we start talking about that, can I just verify your name, address, and date of birth, please?
Yeah, sure. My name is John Smith. My address is 25 Foster Street, right around the corner in Worcester. And my date of birth is January 2nd, 1989.
Okay, awesome. I just pulled your profile up.
Okay.
So, I just want to take a few minutes to go over, your wrist pain. You said it's kind of bothering you.
Yeah.
Just want to make sure that we can treat that the best we can so you don't have any wrist pain anymore.
Sure, that would be excellent. Yeah, I'm really looking for some good advice on this.
Okay, awesome. Well, hopefully I can help you.
Perfect, yes.
So, tell me more about what happened. The wrist been bothering you?
Yeah, it's kind of embarrassing. The other day, got up to go get some water, and I fell over my dog and injured my left wrist. I tried to brace my fall and hurt my wrist.
Okay. So did you see anyone about it, or?
Yeah, I went to the doctor's office the next day, my primary care.
Okay.
Yeah.
And did they tell you anything about it?
Yeah, so they just said it wasn't a big deal, was actually how they phrased it. They said it was just weird. But it was just, they said it was a minor sprain, and they told me that I could take some Tylenol for it.
Okay.
But it just doesn't seem to be cutting it. I'm still experiencing some discomfort.
Okay. And the pain began when you fell, correct?
Yeah, yes.
Okay. And how long has it lasted since then?
It's been about 5 days since that happened, so yeah, about 5 days since the incident.
Okay. And you would say that's a sudden onset, or would you say it kind of gradually got worse?
It was pretty sudden.
Okay.
Yeah, it hurt a lot when I fell. Yeah. It hasn't really gotten worse as much as it's still there, and it's not as severe, but it still feels kind of dull and throbbing.
Okay.
Yeah.
Does anything that you do tend to make it feel better, hurt less?
Yeah, so they actually recommended that I put some ice on it.
Okay.
So that helps. It feels like it actually helps with my wrist is really kind of swollen. So it seems like the ice helps with that. But then it still ends up hurting again a few hours later.
Okay. And does anything make it worse?
Yeah, moving it.
Moving it?
Yeah.
Okay, well, that's pretty typical.
Yep.
So can you describe the pain a little bit, please?
Yeah, so I'll pull up my shirt
Sure.
here. It's right in this general joint kind of area here, and it just really hurts when I move it. It's not really severe as much anymore, but it's just kind of a dull kind of pain. It feels like it's really constricted, like I can't move my wrist.
Would you say it's throbbing too, or more of a burning?
It's more kind of a throbbing pain,
Throbbing?
not burning as much.
Okay. Is it pretty steady? It doesn't go away and come back, or does it come and go depending on?
It's kind of it's steady. It gets a little bit worse when I move it, but yeah, I do have kind of a steady dull pain all the time.
Okay. And has it changed since you it started? Besides going from the acute pain to now the dull pain, has it changed in any way?
Not really. I mean, it seems to be maybe getting a little bit better, but it's still really uncomfortable.
Okay. And you said it was right in this area that it was bothering you?
Yeah, it's right in here.
Okay.
You can actually, if you want to take a look, my other one, see, this one's not as swollen.
Okay, well let me get some information first,
Sure.
And then I'll do that.
Okay, sure, yeah. Okay.
And does the pain stay there, or does it kind of radiate away?
It stays there.
Okay, well, that's good. That's good. Jot that down. Okay. So, just on a scale of 1 to 10, 1 being almost no pain at all, and 10 being the worst pain you can imagine, where would your pain right now be about?
I would say it's maybe 2 or a 3 right now.
2 or 3? Okay.
Yeah.
And when you first fell and it first happened, what would your pain be?
It was worse. It wasn't the worst pain I've had, but it was, out of 10, I would say it was maybe a 5.
Maybe a 5?
Yeah.
Okay. And does it affect your everyday life at all? You're having trouble driving or anything like that?
Yeah, I mean, I can drive, but I tend to favor my right hand on the wheel right now, just because I can't really. The range of motion isn't as good.
Okay.
Yeah.
Let's see that. And you said it's been happening for about 5 days?
Yep, it's been about 5 days since it happened.
Okay.
Mm-hmm.
And can you sleep through the night? Does the pain wake you up at all?
It doesn't wake me up.
Okay.
You know, sometimes it might be a little uncomfortable when I fall asleep. But I do fall asleep, and I've been sleeping pretty normally.
Okay. And is it worse at any time during the day, like when you wake up or when you go to bed?
In the morning, it's usually the worst. Yeah,
Okay.
it is. I think it feels most swollen in the morning.
Okay.
Yeah, I generally ice it before I go to work.
Okay. And what are your feelings on it? How do you feel about it? And it's probably not very much fun.
Yeah, I'm not a big fan of it right now. You know, I hope it gets better soon.
Okay.
So what I realize, it's just a matter of time.
Yeah.
But I definitely would like something to help with the pain.
Okay. What are your hopes for the treatment? Do you want to completely eliminate the pain? Or just kind of reduce it, which is probably the more feasible?
Yeah, I mean, I realize it's not going to go away overnight, so I just like something to kind of help with the pain as my body kind of naturally heals.
Yeah. How long do you think that'll take? The doctor say anything about how long it'll take to heal?
He said about 2 to 3 weeks.
2 to 3 weeks?
Yeah.
Okay. Good. Now, I just want to ask you about some of your medication history, make sure my profile here is up to date.
Okay.
So are you taking any over-the-counter medications?
Yeah, actually, the doctor told me to get some over-the-counter Tylenol, so
Okay.
I've been taking that. I don't know, he told me to take it about every 4 to 6 hours. So
Okay. And you said that doesn't seem to help too much.
I haven't felt any different since
Okay.
I've been taking it at all. No.
Okay. We'll see if we can fix that for you.
Okay.
Are you on any prescription medications?
No, I'm
No?
not. No.
Okay. And any herbals?
No.
No. Okay. Good. So have you ever injured that wrist in the past?
No, this is the first time.
Okay.
Yeah.
And do you have any medical conditions that kind of predispose you to that, such as, arthritis?
No. No.
Osteoporosis?
No.
Okay,
None
that's
of that.
good. So now I just want to take a look at your wrist here. So
Sure.
I'm going to try not to hurt you
Sure,
here.
okay.
So anything, it's rather warm to the touch and a little bit red.
Yeah. It's
And-
it's uncomfortable. Yeah.
Yeah, and if I see your other wrist,
Sure.
those look pretty swollen compared to that one.
Mm.
That's something we'll definitely have to take care of.
Okay.
So what I'm going to do is I'm going to give your doctor a call to see if we can get you on a better medication to try to help control that pain.
Okay.
And I will let you know when I get off the phone with him, and hopefully we can help you out.
Perfect. Thank you.
All right.
I appreciate
Let
it.
me just look up on John's doctor's phone number and give him a quick call here. Ring, ring.
Hello, this is Dr. Pamani.
Hi, Dr. Bimani. This is Alex calling from the pharmacy. How are you today?
I'm doing good. How are you?
I'm doing well, thanks. I just saw one of your patients, John Smith, date of birth 1/2/89. He said he saw you recently?
Yep, that's correct.
Alright, so he just came into the pharmacy complaining about some wrist pain. I was just wondering if you had a few minutes to talk about that?
Yep.
Alright, so he came in and he said he had a pain of 2 to 3 on a scale of 1 to 10, and he's had it for about 5 days. He said you recommended taking acetaminophen 2 to 400 milligrams every 4 hours by mouth as needed. Does that sound right?
That sounds right.
Alright, well, I think he still needs a little more analgesia and possibly an anti-inflammatory. I took a look at his wrist, and it was pretty inflamed and swollen. So I'd like to recommend giving him ibuprofen 600 milligrams 4 times a day with food for about 2 weeks. Does that sound to you?
Oh, that sounds perfect.
Alright, so I'm going to write, transcribe a script for ibuprofen 600 milligrams by mouth 4 times a day with food. That's going to be for number 56, giving him 2 weeks, and 0 refills.
Yep, that sounds good.
Alright, and do you still want him to take that Tylenol, or should we just DC it?
Oh, discontinue it.
Discontinue it? Alright, I'll have him just take the ibuprofen then. And this is Dr. Bani again, correct?
Yep, that's correct.
Alright. I'll see what we can do for John. Thank you very much and have a great day.
You too.
Hi, John.
Hi.
I just got off the phone with your doctor, Dr. Bimani,
Okay.
and we had a brief conversation, and we worked on a new treatment plan for you.
Mm-hmm.
He gave me a new prescription to fill.
Okay.
I went ahead and filled it for you. It's this right here. It's ibuprofen 600 milligrams.
Mm-hmm.
It's a non-steroidal anti-inflammatory drug, so it should help with your wrist pain and the inflammation
That'll
or the
be good.
swelling. So that should go down. You'll get a little more mobility, and
Perfect.
should help the pain a lot.
Okay.
So as I said, it's one pill is 600 milligrams.
Okay.
You're going to take 1 pill 4 times a day.
Okay.
So a total of 4 pills per day.
Okay.
You're going to take it by mouth, and you want to make sure you take it with food.
Okay.
So can you tell me how you're going to take this medication?
Yeah, so I'm going to be taking one of these. You said there's 600 milligram ibuprofens, and you said I'm going to be taking that 4 times a day, and with food, you said?
Yeah.
Okay.
That's because you can get some stomach upset with that, and we want to avoid that.
Yeah, that would be good.
Yeah, I just want to let you know there's a 2-week supply in here, so 56 pills.
Okay.
And you're not going to have any refills because your wrist pain should be pretty much gone.
I hope it's gone away in 2 weeks. Yeah.
If it's not, definitely call Dr. Romani and we'll figure something else out.
Okay.
And just monitor for that stomach upset.
Okay.
If you get anything severe, such as vomiting or heartburn, give us a call. If you can't, feel like you can't take it, I'll talk to Dr. Romani and we can figure something else out.
I think it should be good. I've had it before and I seem to handle it okay. So
Okay.
I'm hoping that'll stay the same.
So here's this. And what questions do you have for me?
Well, I was taking the Tylenol with this. Should I keep taking the Tylenol?
I actually talked to Dr. Bimani on that.
Okay.
He thinks this will be enough on its own, so we're going to have you stop taking Tylenol.
Okay, that's good.
All right. Do you have any other questions?
No, I think you hit all the points. I think I know how to take it now.
All right, excellent.
Hopefully this will work.
If you do have any questions or concerns, my number's on the bottle, so
Okay.
feel free to give me a call day or night. I can talk to Dr. Bimani, and
Okay.
we'll figure something out.
Sounds good.
So I hope your rest feels better. And have a
Thank
great
you. I
day.
do too. Thank you.
Hi, my name's Alex. I'm the pharmacist. Before we, go over some of your pain, I just want to verify, your name, please.
Yeah, sure. My name is John Smith.
Okay, and can I just verify your address, please, so I can pull up your profile?
Yeah, sure. It's actually 25 Foster Street, right around the corner.
Oh, awesome.
Yeah, in Worcester.
All right. So now you said you were having some wrist pain?
Yeah. So
Tell me more about that.
sure. Yeah, it's my left wrist right here. You can tell it's
Okay.
pretty swollen.
Yeah. That looks bad.
Yeah. It was actually the other night. Unfortunately, I got up and I fell over my Jack Russell Terrier, my dog, and